to talk about how we sort of seize this moment of opportunity as we exit the pandemic, or as we, I would say as we exit the pandemic. I'm not sure we are exiting the pandemic, but as we exit this phase of the pandemic, to really understand what we can do now to end homelessness, and how we can do the most good with the resources that we have now. You know, we're all aware that local government is in a cash-strapped financial situation. We would all love more resource, but we also, I think, are getting much better at thinking about how do we use the resource we've got? How do we use evidence? How do we use data? How do we build capacity within local authorities to tackle homelessness in a different way? So we have got some great speakers to lead us off on that. I'll introduce them in a second. The way this is going to work is we'll hear from each of our speakers for 5 to 10 minutes, and then we will open it up into a panel discussion. That discussion, I would really like to focus on how we build the right evidence base for those policies, for the practices that will achieve the best results for people who are homeless or at risk of homelessness. How we build capacity, the capacity to act on that evidence, to improve decision making, and how we change the communications around homelessness, how we sort of move it into a different sort of conversation to try and make sure that homelessness is not a sort of defining feature of people's identity, people's existence. So we're going to hear from each of our speakers in a minute. I'll introduce them properly. We'll then open it up for discussion. I promise, my sort of promise to you all is that we will be done by 11:30 at a sort of absolute maximum, and you can get on with your days. But we'll see how the conversation goes. If it kind of reaches a natural conclusion before then, we won't push it. We'll give you time back. But my promise is that you'll be done by 11:30. A couple of points that I wanted to make. This is a Chatham House conversation, so yeah, we will be doing a write-up of it, but we will not be attributing remarks to people. So I hope that people will feel free to speak openly and to speak, you know, as freely as, I mean, I always say this, it's never actually a problem with the local government audience. I never really have a sense that people are holding back particularly, but please don't. You will have noticed that we are recording the conversation. That is purely to assist us with writing up that note. We will not be broadcasting it. We will not be, that recording won't go out anywhere. So again, please don't feel constrained by that. What I would ask people to do is we're quite a lot of people on the call, so we're not going to have time to do a kind of round robin of introductions. But if you feel comfortable doing so, you don't have to do so. When you enter the discussion, if I bring you into the discussion, then please say who you are and what your sort of relevant affiliation is. I'll say more about this when we get there, but the way we'll run the discussion is people can raise a hand either virtually or in the old-fashioned way, or you can sort of drop something in the chat and I'll try and sort of pick that all up. It's harder on Zoom, so bear with me, but we will get everyone in. Okay, so if that sounds like a reasonable way to spend the next hour and 25 minutes of your life, let's get going. If it doesn't, now is the time to, and you know, this is one of the advantages of doing it on Zoom, you don't have to stand up and leave the room, you can just quietly sidle out. So if that doesn't sound like a good use of your time, now's the time to leave. But I promise you that it will be. So let's get into hearing from our speakers. So our first speaker, I'm really delighted to have her here today, is Dr. Ligia Teixeira, who's Chief Executive at the Centre for Homelessness Impact. She founded the centre. It was part of the What Works network, which you'll all be familiar with, in 2018. Before that, she was Head of Research and Evaluation at Crisis UK. She's also worked for the Young Foundation and for the Refugee Council. So a huge track record in really getting under the bonnet of some of these complex issues around housing and homelessness. So without further ado, Ligia, I'm going to pass the floor to you. And yeah, off you go.
Thank you so much, Jonathan, and for bringing us together today. I'm really looking forward to hearing from the other speakers and people on the line. So as you well know, homelessness is systemic and it's stubborn. So to accomplish our collective mission of ending homelessness for good, we need to know what works and put that into practice. At CHI, we take on 3 main activities to make that happen. We build the evidence about the policies and interventions that will achieve the most effective and efficient results. We then support policymakers and practitioners to ask the right questions and implement what works according to the evidence and their own local context. And we're growing a movement for evidence-led change to ensure gains are long-lasting, hence the campaign that you mentioned. So how do we build the capacity needed to act promptly on the best knowledge available to improve decisions and help limited resources go further? So first, we need to work with local authorities and tailor our approach to challenges they are facing. In our case, we work with a variety of LAs, from the Highlands in Scotland to Bournemouth, Christchurch and Poole on the South Coast, and many in between, to help improve their knowledge and skills in a variety of crucial areas. They face many unique challenges. We work with both Tier 1 and 2 LAs, which have different responsibilities in regards to homelessness. We work with both urban and rural LAs, which face very different needs and populations facing homelessness. But they have things in common as well. Across the board, homelessness spending has been going up, and this started pre-pandemic. We're spending at least 10 times more on homelessness than we did 10 years ago. So that's a big difference. And nearly every LA we've worked with in the past year is facing increasing levels of temporary accommodation, both from COVID and in response to previous needs. They need tools, techniques, and creative mindsets to address those challenges. And so that's why we focused our learning program this year on temporary accommodation broadly, while digging into the differences in each local area situations within that topic. The other thing that we focus on is, of course, building capacity by making evidence easier to understand and apply for evidence tools. And if you're not familiar with them yet, they're available anytime, anywhere on the web for practitioners, policymakers to access, search, and use. We also use our free evidence surgeries to help organizations understand their data and evidence needs and context to build and plan for action. And finally, we build capacity through our What Works community program, where we work side by side with LAs like LAs joining today through an intensive learning program focused on a local challenge. This year, we focus broadly, like I said, on reducing the use of temporary accommodation and focusing on long-term placements, a result that is a good outcome for people experiencing homelessness and can save money as well in LAs in the longer term. So to really build capacity, though, we have to dig into how that issue manifests itself at local level. So for each area, we work with a team of employees and partners to define the local issue very clearly, so we can understand what the evidence tells us and think of new creative things to do. Each local area's challenge was slightly different, though. So in Hull, for instance, the team focused on the revolving door of around 110 18 to 26-year-olds who keep coming back for temporary accommodation services over and over. How might we address their needs more sustainably? While in Rochdale, the team focused on the explosion in usage of B&Bs, one of the lowest qualities and highest cost accommodation types, which had nearly doubled in the past year. How might we reduce the reliance on B&Bs and shift to higher quality options? And we then facilitated hands-on workshops and one-to-one support where we looked at data in each LA, built skills in design thinking and behavioral economics, and supported the teams to pitch their potential responses to challenges to their senior leadership. Overall, this journey is meant to build capacity by providing several critical elements: space for learning, connections to really important real-world challenges, evidence translated for use, and of course, connection to experts and peers, not just within the UK, but internationally. So each of these elements helps policymakers and practitioners hopefully understand their context even better, the knowledge available, and enable them to act more promptly, even more promptly. But we need capacity and commitment at all levels, of course, and we need leaders from the chief executive on down to engage early with the evidence and their teams to provide support. We need to provide space to learn and not get bogged down in the day-to-day grinds of regular work, which is really, really difficult. And we need commitment from frontline staff to try new things and change their mindset to using evidence in their daily work. Overall, building the capacity needed to act promptly on the best knowledge available to improve decisions and help limited resources go further is about cultural change. This is what we believe. We need to know what works, have the space, resources, and commitment to turn into practice, and be able to mobilize good practices for more and more people. So this is a huge shift for us, but ultimately, in this moment of great change, if we are to achieve our shared ambition to end homelessness for good, we must use this opportunity to understand how to end it even more effectively, how to end it sustainably, and how to end it with evidence. Thank you.
Lysia, thank you. That's great. And really interesting that sort of the juxtaposition of the sort of the technical things we need to do around sort of evidence, but also linking that to sort of cultural change in terms of how we work. And I think all too often we tend to kind of get sort of channeled into thinking about one of those things when in fact they have to go together to be effective. So really, really interesting. Look, enough from me. Our second of our three speakers is Robert Pollock, who is Chief Executive of Cambridge City Council and has been for a relatively short time. He took over in that post earlier this year. Before going to Cambridge, Robert was a director at Social Finance, which is a social enterprise that partners with governments and charities and financial community to try and find different new solutions to entrench sort of public policy problems. And we knew Robert in that context because he was part of the LGIU's Homelessness Commission a couple of years ago, which looked at strategies for tackling homelessness and rough sleeping. Before Social Finance, Robert was in central government, though we forgive him for that, with a variety of roles in the Treasury and at MSCLG. And if I recall rightly, Robert, you led a cross-department team looking at sort of public service transformation back in, feels like a long time ago now, but it's probably only about 10 years ago. Robert, over to you.
Thanks very much, Jonathan, and thanks very much to colleagues at LGIU and the Centre for Homelessness Impact for inviting me today. It's week 10, so I'm going to do my best to give you a kind of snapshot of what's been going on in Cambridge and talk a little bit about evidence. So we're a relatively small city, around 130 to 140,000 people, but we've got a huge housing affordability challenge. It's worse than many parts of London. So average prices relative to median wages can be 14 to 19 times. So that's really enormous. It prices a load of people out. About a third of our residents are in the private rented sector. We've got a stock of 7,000 social homes, but we're a really fast growing area. And so supply of affordable homes to own and rent is a massive challenge. So we've got a relatively large and growing homelessness pressures and a high number of rough sleepers for a city our size. But during the last 12, 16 months, it's just been incredibly busy. We've helped to take 250 people off the streets. So rough sleeping levels now are around about the same as they were, lower actually than pre-pandemic. We've made over 300 offers of accommodation the last financial year, moved around 160 rough sleepers from emergency accommodation at the beginning of the pandemic into more suitable longer term accommodation. So that's approximately the number of people that have been sleeping rough in the city on average for the last 3 years. And I think what was great about that was there were no confirmed cases of COVID transmission in emergency accommodation. So the team has done a really amazing job. We've also managed to help individuals who have had no recourse to public funds to gain settled or pre-settled status so that they get a housing option offer. And I suppose all of that, we've had really good feedback. We've got a really thriving voluntary community charity and homelessness provider sector in the city, coordinated by a great organization called It Takes a City, which is like a platform for homelessness. But setting aside everyone in, there's been about 450 homeless prevention interventions, and we've helped 200 people into the private rented sector. So there's a lot of activity going on, and we're you know, we're a city district, but we are a university city with a large tech research and data community. So, pardon the pun, the evidence-based policy is in our DNA. But at the same time, we've got to recognize that as a smaller authority, we need to tailor our approach to evidence to suit the scale of the challenge. So we need to act proportionately. So we do have a case management referral analytics system called Inform, which we use with our partners. It's cloud-based. You know, we've managed to retain, which, you know, I think has been quite an achievement, a dedicated policy and performance capability in our homelessness and housing team. And I'd say for a district of our size, we've got a relatively mature approach to the use of data. We need to take steps to improve that. So over this next year, we've set aside a bit of resource to work with our partners to do a bit of data wrangling and cleansing. You know, we need to improve the data we get first, otherwise that's not going to really help inform what we commission or how we try to curate the local system. And I think overall we're trying to use data, both qualitative and quantitative, to promote a kind of adapt and learn approach so that we're continually improving and focusing on outcomes. If you've got a smaller team as we have, then sometimes I think you can do data analysis that can be quite simple. It just requires a bit of curiosity and a bit of confidence in how you use and interpret data. So the team gave me two, I think, really interesting and relatively straightforward examples where they were really concerned to better understand what was triggering homelessness presentation in the city. So they looked at the two key drivers in our context, which was landlords issuing Section 21 notices, tenants vacate properties, and young people being asked to leave home by families. And I think doing some detailed casework really helped to focus attention and resources on some of the specific events and drivers that so that we can try and pick them up in advance and support demand reduction or preventative activity. I think the second goes back to no recourse to public funds, which has been a big issue, certainly when I was involved with it in London during Everyone In. So we had around 50 people. Is that my time to stop talking, the bling bling? No, I'll carry on. But do tell me when my time's up.
That was just someone entering the room. Keep going.
So just no recourse to public funds. You know, what we did was look at the 50 individuals that we were working with during Everyone In and figured out that actually only we could help assist the bulk of them to normalize their circumstances. So there's only 10 really that we couldn't support with statutory funding that have been subsequently supported by our charity and voluntary sector. So, you know, that's just two examples of being curious and going into the data that's already available to you. I think in looking ahead, this is about some of the future challenges and that we're going to face. I am particularly concerned about the pressure in the system and the impact of the end of restrictions and potential evictions shortly. I'd like to see a plan from the government, a timely plan for the government on that. As many local authorities, we continue to have challenges securing suitable property. I think there could be a further pressure on the system when the EU settlement scheme application deadline closes. And probably common to many of you listening, the way that the system works, you know, there's a great opportunity as we move into an integrated care system, but substance misuse, mental health, and rough sleeping, you know, are drivers that really we need to get under the skin of. And we're hoping to be part of MHCLG's Changing Futures program, working with MEME and others to address that. Some of our evidence base over the last year is going to shape and inform a new commissioning partnership across the city called Streets to Home, and data will be a really important part of managing the resources across the system. So that's we're also considering whether or not we can use an outcomes-based finance approach to that. I've got some asks of government, but maybe I'll leave those for the discussion. I thought, you know, it's important in all this data, and I think what's really great about the campaign ending with evidence, is that homeless individuals are not faceless. So I've got just a short pen sketch of someone that we've worked with over the last few years, because I do think compassion and collaboration are really important as well. So John, it's not his real name, has been known to Cambridge officers and residents for a long time. He's a constant and challenging presence in the city centre. He's only stayed in shelters for a few nights at a time, but he's visited the local A&E on dozens of occasions over the last few years. His drinking was previously out of control, and mental health and physical health in a rapid state of decline. Then he walked out in front of a car, ended up in hospital, was going to be discharged onto the streets. So our homelessness team and some of our partners started working with him, found him secure accommodation. Then coronavirus struck. So we provided him with wraparound support, a dedicated support worker, a local charity, Change, Grow, Live, provided drug and alcohol support. Volunteers were providing daily food deliveries. Another homelessness provider was providing support with well-being. So there's a lot there, a lot of compassion for John. I think the shock of coronavirus and a crash was a big impetus in him wanting to move out of emergency accommodation. And one of the bits of innovation that we've tried to do in Cambridge has been setting up small modular home schemes. So we've now got about 12 in the city, and John moved into one of these modular homes. It's kind of an intermediary step, but you get your own house. It's small, they are modular, so they can be moved. And we've got around 2, maybe 3 sites at the moment, and plans to grow that to up to 30 different units. So that's just a really practical story of someone coming from the streets and finding a home that's theirs. I think I'll leave it there. Thanks.
Thank you. Thanks, Robert. That's a very powerful place to leave it, actually, because a reminder that when we talk about data is not just numbers on a spreadsheet or sort of information in a system. In the end, it's people that we're talking about, and what that data is about is people. So I think that's very powerful. I also really enjoyed the emphasis on curiosity. I think that's a very, very powerful driver. And I also enjoyed the subtle reminder that the function of DNA was, of course, announced in a Cambridge pub. Our last speaker is close to home. It's Andrew Walker, who's head of research here at LGIU, and he leads our work on housing and homelessness, as well as our work on devolution and local economic growth. Andrew, over to you.
Thank you very much. Yeah, thanks to the 2 speakers, really interesting presentations. I just wanted to offer a few thoughts based on work that we've done at LGIU, looking specifically at homelessness, but also in a more general sense, looking at other areas of local public policy where the role of evidence, the role of data, the role of sort of knowledge and understanding, I think has been a really key theme. And it's a key theme for us in our research. We've just recently launched a new local democracy research centre. And one of the sort of investigations that we are aiming to pursue over the long term is really digging into this role of evidence, how evidence is used and understood, what kinds of skills and capacities are required at the local level in order to embed it. So I think it's a really important thing, and I think it's become all the more important actually over the past sort of 18 months or so. I think it's sort of risen up the agenda, and I think it's being recognised as having a very decisive role. But it was also the use of data and use of evidence was a crucial part of the work that we did a couple of years ago when we led a local government homelessness commission, which was investigating, along with local government partners and experts, how local authorities were going to sort of manage the introduction of the Homelessness Reduction Act, all these new responsibilities, with little extra support and resources. And one of the ways in which we found that councils were stepping up, or were going to need to step up to fulfil those responsibilities, was by using evidence better, but also by government and others providing better, more coherent data. So initially, I just want to offer some general thoughts about evidence in local government, and then some more specific ones about homelessness in particular. Recent work that we've done looking at wellbeing policy, we published a report last week, threw up lots of interesting stuff around data and around the use of evidence. And in our interviews, we found lots of people talking about how data, on the one hand, can be used as a practical tool, and it can sort of provide answers and solutions in a very practical sense, but it can also actually be quite a totemic thing. And we found some councils really use evidence and data in order to drive a mission, to drive an agenda, you know, public policy across the council can sort of cohere around a shared understanding of what we're doing with data. But that can also then be used to lobby government, to make the case to government and to others about the impacts of certain policy interventions, or about the need for certain policy interventions. And one of the case studies that we collected in our recent report was on the Social Progress Index, which the London Borough of Barking and Dagenham set up. And has been sort of building over the past few years. And it's really interesting. It's a really interesting case, gathering a huge amount of data across all sorts of different social and economic indicators across the population. And they then use that data as a benchmark to test different kinds of policy interventions, but also, as I was mentioning, to go to government and to say, this is not good enough, this needs to be improved, and we need these things in order to do it. And I think it can be a really, really powerful tool. But I think that point about it being sort of totemic, I think is really interesting. And I think we sort of need to get to a place in local government more generally where we really see data as something that can help to sort of to drive a mission. Lots of councils collect all sorts of data, and we know that there's all sorts of data flying around, but it's about sort of enabling it, using it to drive that agenda. We've also found that there are all sorts of different kinds of evidence, and this has been touched on by the previous speakers. That there's data, there's hard numbers, but qualitative data is also really, really important. And we've just heard the sort of the story of this is about people, and it's about their lives, and trying to sort of build an understanding around something qualitative that matches up with other forms of data, I think is really, really important. But there's a sort of underlying point, I think, about, because data is a tool and evidence is a tool, it doesn't sort of drive a mission itself. We really need to have a coherent and a shared understanding of why we're using it. What are we gathering this data for? How can we build it into the wider agenda? How can we make it work for us? Not to be scared of it, but also not to see it as a sort of holy grail. It doesn't solve problems in and of itself. And that's another issue that we've found in that research, is about really building a shared understanding of what the data is for, what it tells us across the organisation, building links between different areas of practice. So some specific thoughts then from what we found in the Homelessness Commission, as I said, building on from the Introduction to the Homelessness Reduction Act. We found that the links and relationships were really important between different areas of service. One of the things that came up constantly in our evidence sessions was that this is not just about housing options necessarily. This is not just about sort of solutions that come from one department, that actually we need to be gathering data from across a whole range of different areas. We've heard a bit about that from Robert, but that requires that collective effort and that sort of shared understanding. That's important in central government, just as it's important within local authorities. We need to really build a decent understanding of what those key trigger points are that we're gathering data around, and that goes back, I think, to that point around understanding why and what the data is for. what can it tell us that's actually useful? You know, we know that there are important trigger points around debt and around other sorts of, you know, socioeconomic issues, but also around key changes in people's lives that might indicate that the risk level is rising. And so really understanding how the data can help us to understand those things, again, requires qualitative understanding as well as quantitative. We found a real need for leadership, and here, you know, I'd echo Lygia's comments there about getting the leadership right. The case study that we picked up during the Homelessness Commission from Hackney Council was quite instructive in that sense. You know, there was a real sense of leadership for the data-driven approach that meant that practice could be embedded across the council. One of the other really important lessons actually from Hackney that we really championed, or tried to champion in that report, was around getting the basics right to build a database, a data-based approach, not to build a database, to build an approach that is based on data. There was an awareness, I think, that we've got a long way to go, but actually what we found from Hackney and from a few others was that there are steps that you need to go through. That it's important to get those basics in place before you can build it into something much grander. There was another really important theme that came out of the Homelessness Commission around the language and around building the case for data. Lots of stuff around sort of predictive analytics and Cambridge Analytica and these sort of quite sort of scary things that get thrown around in public discourse when we talk around, you know, the public gathering of data and the government holding data about people, is really not very helpful when it comes to designing policy. And so there's a real case, I think, for building a really positive argument around data and showing what it can do, showing the potential. I think over the past year, over the course of the pandemic, that case has been strengthened, but I think we still need to drive it home. And I'd highlight another case study from our recent report on wellbeing. Bradford City Council have done a scoping project building up what they call a local authority research service, working with partners in the NHS and elsewhere across the city to build up the capacity and the sort of understanding of how research and evidence gathering fits into public policy across the city. So that's partly about gathering data, but it's also about understanding how officers within the local authority and other public sector agencies use research, how they engage with research. They found that 79% of officers, you know, wanted to use research and tried to, but that it needed a sort of systematic application. And so part of that project in Bradford is to build the infrastructure, the institutional infrastructure to make research available, but also to make sure that it's relevant and useful for policy. Finally, I'll make a point about partnerships. Partnerships are really essential, and you know, we need to sort of build that capacity around using data for partnerships. And a case study from Newcastle City Council is instructive in that sense, where they use their trailblazer work to really build effective partnerships across the public sector organisations across the city to share information and understanding about people that were at risk of homelessness. So I think just in general, just to wrap up, there are some key challenges around building the capacity for using evidence and using data. Local authorities are political organisations. That makes these kinds of conversations at times quite challenging when there's a pressure to find quick wins, to provide quick answers. You know, building this sort of understanding that we're talking about, building the data and understanding what it tells us, that's time consuming and it's complex. And it requires a focus on systems and on place and these other sort of ways of viewing public policy. There's a challenge about really, you know, getting a shared understanding of what counts as evidence, what's admissible as evidence. How do we build the evidence case for certain policy interventions? Lots of people that we spoke to for our recent research on wellbeing were telling us that, you know, a phone call from a resident to a counsellor, that can count as evidence. how you then weigh that up against population level data, spending, cost benefit, all these things, that's part of the debate, that's part of the challenge, but it's nevertheless, it counts as evidence. I think just finally, and then I will finish, that there's the real importance of a set of concrete skills around understanding and analysing evidence. But there's also, I think, an important set of challenges around getting the right sorts of institutional structures, embedding the right sorts of behaviours, figuring out the sorts of values and priorities within organisations that exist around data, in order to embed the right approaches, in order to build the right mechanisms for good data use, and to reduce the barriers for building that data and evidence into public policy. Thank you.
Great, thank you, Andrew. Yeah, really important discussion about, not all data is equal, and we need to be mindful about how we use data and not treat it as a goal in and of itself. It's about outcomes and about what we do with it and the judgments we apply to it. So that's really important. Okay, brilliant. Thank you to all three of our speakers. Fascinating insights there. Leaves us with about just over 45 minutes for a conversation. So the way this works is I will take points from the chat, but I'll also take points from the floor if people want to raise their hands, either virtually or in real life. There are over 30 people in the call, which is great. That does mean that you're spread across several screens. So I'm sort of moving backwards and forwards, and my team will help me find people. So if it takes me a minute or two to see your hand,